Hello, good evening, and welcome to our webinar. Tonight we're going to be talking about all things SOT, just all the basic things that you want to know about SOT if you're considering using SOT therapy, and we will cover exactly what that is in a minute. So just a couple of quick introductions before we get started while people come on here. For those of you that don't know me, my name is Dr. Nicola Ducharme. I'm the owner and medical director of RestorMedicine. We're an integrative clinic in San Diego, California, and we work with patients all over the country and indeed the world, treating chronic infections, tick-borne illness, mycotoxin illness, mast cell activation, all the chronic complex illness stuff. This is my colleague, Dr. Juliana Dudas. We call her Dr. Jules. And she is on our team at RestorMedicine, and she heads up the IV and ozone department and is also our SOT practitioner. And we are both certified with RGCC in SOT. So we wanted to share some information tonight. Jules has been working with us and our patients for the last few months, and we've been doing SOT at Restore for over a year now. So we're very excited and happy with what we're seeing. So we thought we would just share some information. So Dr. Jules, do you want to just say hi and introduce yourself a little bit before we get started?
Yeah, hi, I'm Dr. Jules, and thank you for the intro, Dr. Nicola. So yeah, I've been at Restore. I kind of started in December and started on with the RGCC stuff in January and do all the injection and intravenous therapies as well as patient care here at Restore. But yeah, definitely working with all the complex chronic illness, everything from mold and mast cell to the vector-borne and some of the tick-borne illnesses as well. And also some integrative oncology that I've started to do too. So yeah.
Which is fascinating, and that might be another whole good webinar topic into itself. But Dr. Jules and I say, chronic illness is our jam, right? That's our thing. It's not for every practitioner, but we somehow love it and thrive on it, and that's our jam. So.
Yes, it is.
So, Dr. Jules, why don't you just start out by giving a little description of SOT and what it stands for, and kind of if you can give just a layperson's description, because it's very cool. We could geek out on the science of this for a long time. It's very, very cool, but just help people to understand, like when we say SOT, what are we talking about?
Yeah, so SOT is supportive oligonucleotide therapy. And essentially, in a nutshell, what it is it's a polymer, just meaning it's this molecule, and it's oligonucleotide. And so I like to use the analogy of it's like a key that we're cutting to whatever the specific pathogen is that we are looking to target in the patient. So how this fits in with some of our complex chronic illness, particularly with tick-borne and chronic viral illness, is that we can cut these keys, these SOT molecules, to that specific pathogen that we want to target. So whether that is a herpes family virus or a Borrelia species. And basically we work with RGCC labs, and they are in Europe, and we draw the patient's blood, and then from the blood, based on what the positive test results are that a patient has had for one of these pathogens, then the lab goes in, takes the blood, and based on what they find there, makes these molecules. And so when we get them back, it's literally, hundreds of thousands of these molecules that come back, and I reconstitute them and then deliver them as an infusion with saline. So it's a hydrating infusion, and it's a pretty simple procedure. So that's in a nutshell what it is.
Yeah, and I think what's so cool about it, like I sort of think that, when we're looking at working with chronic infections like Lyme and some of these viruses too, like there's a lot of things that we can do to sort of help kill off and eradicate the bacteria and the pathogens. But this is kind of working to like hinder the replication, right? So it's not necessarily a standalone therapy, but as we still use our antimicrobials or our ozone or our antibiotics or our herbs or whatever we're using, the SOT is working in the body for up to 6 months to dampen the replication of the pathogen. So
yeah, so the actual mechanism of action is that molecule, that oligonucleotide sequence, it goes into the cell. So say we make one for Borrelia burgdorferi, it finds a Borrelia burgdorferi cell, gets admitted into that cell, and then it binds to, so it's called antisense. So it binds to the RNA that's existing in the cell, and it essentially throws a wrench into the metabolic workings of the cell so that the cell can no longer live. And so then the cell essentially dies. So it's like I said, it's like a specific key to a specific lock that then, targets these cells and brings the pathogen load down. So it has the potential to kill, hundreds of thousands of these cells that might be in somebody's body. And yes, the SOTs themselves, the research has shown that they remain active anywhere between 12 to 24 weeks. So you've got this 6-month period where the SOT is still really working within the body.
it's so cool. It's so cool. So you mentioned like tick-borne illness, you mentioned viruses. And so let's run through and kind of share with folks like what can SOT be used for? And if you want to touch on the cancer piece, feel free, even though that's not the target of like the topic, but if you want to just touch on that, you're welcome to. But I really like looking at the different kinds of pathogens that the therapy can be used for.
Yeah, absolutely. So the antisense therapy, the SOT, it was originally developed. RGCC has its main focus in oncology. And so they originally were working with this therapeutic to, work in an oncology capacity to target circulating tumor cells. But what they found was that it had this incredible efficacy against specific pathogens, particularly something like the spirochete bacteria. And so, then they started working with developing these SOTs for different of these vector-borne species and some of our parasitic species, as well as viruses. And, not only case studies, but then also the research that has been done has shown this just great potential in reducing the load of whatever the pathogen is with the SOT therapy. So, yeah, it's very
That's
exciting.
awesome. And I'll see if I pulled up the list real quick here.
Okay.
So,
You want to start out? Yeah.
yeah, so I mean, I'll just run through some. This is not everything, but herpes simplex, varicella zoster, Epstein-Barr, Hep B, Hep C, Coxsackie virus. So these are all viruses that, we do see our patients having like high antibodies. But then when I look at the Borrelia species, there's like 19 different species of Borrelia. There's 6 different species of Bartonella, 6 species of Babesia, and then Anaplasma, Rickettsia, and Ehrlichia, like the major species there. So it really is pretty comprehensive. So I guess that leads us to another question, Jules, like how do we pick the targets? Like, do you want to talk people through like what that process is?
Yeah. So RGCC has determined like let's make sure that this is something that is definitely active and within the patient's system. They have their own testing that you can do for all of these pathogens. So you can do that through RGCC labs. However, they will accept, some of our more commonly used labs. So we work a lot with IGeneX, we work a lot with Vibrant, but they'll also take something like a T Labs or a Galaxy, or a Fish, if you're doing one of those, say for like a Bartonella. And so basically they require that you have a positive test result within the last 6 months prior to the blood draw that we do for the SOT. And I personally like to use the Vibrant Lab just because they do show all these different species, particularly like all the Borrelia species, the different Bartonella and Babesia species. But again, if you're going with one of the other specialty labs, that works as well. So just what we need is that positive result within the last few months, up to 6 months prior to the blood draw for the SOT, and then we can create SOTs based on what's found in the blood.
Yeah, and so what I would add with that, so I'm very much team IGeneX, like generally speaking, like when I have a new patient that comes in and it's like, is it Lyme, is it not Lyme, what co-infections, then I'm strong team IGeneX on that. I will say that we do use Vibrant for SOTs for a couple of different reasons. One is that they have slightly lower threshold for what they would consider positive. And so it makes it slightly easier to get a positive test result.
Yeah.
Which may be ambiguous in an original diagnosis, but for this purpose actually works in our favor. And they are a little bit more specific on speciation. So like saying we want an SOT for Bartonella isn't enough. We have to specify, well, is it Bartonella henselae? Is it Bartonella elizabethae? Like what kind of Bartonella is it? And so, and we'll talk about that in a little bit about like how many SOTs do you do and how, so you have to be very, very specific, and Vibrant just gives that slightly extra level of specificity in terms of the species that we're going after. So I kind of say like, okay, it's all Borrelia, but within that, there's different strains of Borrelia. It's like if you have a dog, like a Dachshund and a Chihuahua, they're both still dogs, but they're specific kinds of dogs. So you have to know what kind of dog you're looking for the SOT for when we order it. So that's why Vibrant tends to give us a little bit more clarification on that. But of course, in doing so, like it's not just about what comes up on the labs. It's about what do we know about the patient? Like what are your symptoms? What do you deal with? What seems to be a dominant infection in your body? And so, it's not just about what the paper says. It's also about what your body says. And so Dr. Jules and I, like, if it's a patient of mine and I know them well, like we'll work together on what I think might be the dominant infection or co-infection for them. And then we'll look at the labs and we'll kind of put that together. And that's also why one of the first steps on the SOT journey with us at RestorMedicine anyway is an SOT consult with Dr. Jules, where she would look at that and kind of look at the patient situation and look at the labs and put all of that sort of information together. So it's a combination of those things.
Yeah. So, I mean, like based on clinical presentation, we can say, it seems as though you are experiencing this pathogen, but then we will do the testing. And yeah, I think Dr. Nikla, as you said, it's important with the RGCC, with making this SOT, to have as much specificity in terms of species as possible, just because on their end they're looking at, they have their testing that they are doing on the blood as well and making the SOT, and so they're doing that against sequencing, like essentially gene sequencing, so when they're making the oligonucleotide sequence. So
yeah. Well, and also, I mean, for us clinically, like I can have a patient and be like, oh, that's a raging case of Babesia. That's a dominant co-infection, but that I won't know within that what strain of Babesia it is, right? So that's where, again, we need the lab. Like we could say, okay, we think Bartonella would be a good starting point, but we still need the lab to show what strain of Bartonella. And in doing that, typically we will pick the one that has the higher antibody level, like the higher level of reactivity, because that's tripping out the immune system more than the others.
totally.
Yeah, so we've talked about that. So let's talk a little bit about like how many treatments are needed. Like, is it a one and done? Do we just target one pathogen? Like, how is that going?
Yeah. So, it's going to be based on a lot of things. So there's a timeline that's involved with this. So, for some of my patients, maybe they are looking to have another child, or they're going to be traveling, or they're going to be doing, some kind of large work project. So we're spacing out the SOTs. So when we're doing the blood draw and when we're actually doing the therapy or therapies, if they decide to do multiple, and the reason I say this is because it takes about a month or 4 weeks for the SOT to actually be made and then get shipped back to us. And during that time, so up until 14 days before the blood draw, the lab requires that the patient is off of any therapeutics targeting that specific pathogen. So if you're treating a Borrelia, they would prefer that you're off of anything that's targeting the Borrelia for 14 days prior to the blood draw. As soon as you get your blood drawn, you can go back on whatever regimen you're on that's treating the pathogen that you're treating. And then again, 14 days prior to the actual SOT, again, we don't want to be on therapeutics. And then for 7 days after, we don't want to be on any therapeutics for that specific target. So this becomes something that, the patient is going to need to navigate based on what's going on in their life. That being said, you can do SOTs as soon as they say, RGC says, as soon as 7 days apart from one another for different targets. So you could do a Borrelia and then a Bartonella. However, in my clinical experience and opinion, I think we should wait about 3 weeks between each one at a minimum. And I say that because we want to see how the patient is responding. There can be a potential kind of Herxheimer or die-off reaction. The procedure itself, some people respond differently to different kinds of intravenous therapies. So I personally like to wait 3 weeks in between. And if you're so for one single target, so again, let's use the example of Borrelia burgdorferi, you can do up to 3 of those for the same target in 1 year. So 4 months apart for each one of those if you're targeting the same species. So the research that our GCC has done, as well as other case studies that are out there, it's kind of shown that the greatest success with SOT for some of the tick-borne pathogens, it's 1 to 2 SOT infusions per target. And with the viral, it's going to be 2 to 3 times for the same target. Now, I, as well as many other practitioners, have noticed that there is a great synergistic and additive effect in bringing in other therapeutics supporting along with the SOT. So I think it's important to keep in mind that SOT wouldn't be just the only therapy that you're going to be doing to target something. So along with that, we would be wanting to use, whether it's our herbal protocols, our nutraceutical protocols, our other, immune supporting protocols that are going along with whatever it is that we're trying to fight and eradicate. So I hope that kind of gives an overview of how often and how many.
Yeah, the other things that I would add there, so we talked about being off like antimicrobials that target that pathogen, but remember that especially in nature with natural antimicrobials, like they're more broad spectrum than like some of our antibiotics are very, very specific, right? That this antibiotic targets this or this antiparasitic targets that, whereas in nature, antimicrobials may have antibacterial properties and antiparasitic properties and antiviral properties. And so we need to be very careful. Like for the most part, we advise people are off, most antimicrobials for that 2-week period. And it's really just that we want the SOT to have the best chance, right? We don't want to negate any of the value. We want that pathogen to actually be a little bit more active so that they can really kind of get a good therapeutic remedy for it.
Right. So it's like, yeah, you kind of want the load to go up in the blood before you do the SOT draw.
Yeah, because you want them to be able to do their thing.
And so that the lab itself can be like, okay, here it is, here's the bug, and we're seeing the DNA for it, that the specific sequencing for the specific proteins that we want to target.
Yeah.
And I should add on, so even though each different SOT must be spaced at least 7 days apart, they recommend that you can do a total of 9 SOTs in a 12-month period, should you really want to go real hard and heavy on the SOTs.
So 9 for any targets.
9. And I actually, in my mind, I switched to the 3 and 4. So it's actually, you can do 4 for the same target in a 12-month period, so 3 months apart.
So theoretically 3 months apart, but we wouldn't typically do that because we know that the SOT can work for up to 6 months. So right. I mean, I think for us, it would makes more sense to do fewer SOT, like maybe 2 SOTs for one target, but do like cover more targets.
Yes.
So, I think that's one thing we've really learned with SOT is, and like I said earlier, it's not a one and done. Like if you're going to get into SOT and you have like multiple pathogens or co-infections, really consider that you're likely going to need to do 3 or 4 different targets. It doesn't necessarily mean that you're going to need to repeat those 3 or 4. But I would go in thinking that, you may need to do 3 or 4. Now, I also have lots of patients who are, recovering from tick-borne illness and have lots of antibodies to various viruses. But this is my theory, and I've said this a lot, and this is just my opinion. In my mind, when there's tick-borne pathogens, they are primary. And there's very, very few people I can ever think of over a 20-year period who don't test positive IgG on Epstein-Barr or cytomegalo. Mycoplasma pneumonia is another one. Like everybody has IgG antibodies for that. And so, if something's IgM in the viral realm, that's a different thing. And we've definitely had patients in that situation who've done SOT for viruses. But my advice to people is always like, if you've got multiple tick-borne pathogens, start there. Like, don't get too distracted by viruses, because in my view, they're more like computer programs running in the background rather than being the primary offenders themselves. And part of the reason why I say that is because I've had oodles of patients who've come to me diagnosed with Epstein-Barr, like as their main problem, probably by a practitioner that was extremely well-meaning and knowledgeable, but just didn't have that next step of knowledge of like, oh, but maybe it could be Lyme and tick-borne illness. And, they did 2-3 years of antivirals and maybe even, Valtrex and sometimes even Valsite. And I mean, lots of different things and not made any progress. So we typically recommend people, if you've got the tick-borne stuff going on, start there. Try and cover a couple of different co-infections or different of the tick-borne pathogens. And don't get distracted by the viruses if you've just got the IgGs running in the background. And we also recommend, we go in telling people to think about doing 1 SOT per target. Like we don't go in telling people that they're going to need 2 or 3 because we haven't necessarily found that to be the case. But we are pretty clear with people that if you have multiple co-infections, then to get the best results out of SOT, you do want to cover, at least a couple, 2, 3, if not more of the different bugs.
Yeah. And so like going along with that, I think, yeah, exactly. SOT is so patient specific. So not only is it patient specific, like on a molecular level, so like it's completely individualized to the patient, to whatever subspecies that they specifically have for these pathogens. But it's like, some patients, they do want SOT and we see the actual load, like the actual numbers of, how high is that IgG and IgM testing, and we'll see the IgM go away and seroconvert, and we'll see that IgG load go down. And then that, along with the clinical presentation, it's like, well, we know we've kind of gotten that one. We've successfully brought that load down, and now let's focus on whatever our next target is. When I said 1 to 2 and 2 to 3, that's just kind of what the research has shown in terms of numbers and in terms of being able to eradicate, to a very statistically significant level. And, I should also say that, with the research, the success rate is pretty amazing. It's upwards of 95% for the tick-borne stuff, and sort of in the high 75 to 80% with the viral. So, it definitely does seem to target and reduce the load for these pathogens.
I know, it's pretty amazing.
Yeah.
So I want to just cover a couple of different things. One is what can people expect? And we can only speak for how we do things at RestorMedicine. I've heard of other clinics doing things differently, but Jules, just talk people through the process. Like if someone was interested, like what would be the step-by-step process and the timeline of doing all the things. And then after that, we'll talk a little bit about what people can expect like after they have the infusion.
Yeah, sure. So I'll sort of run through like the fastest possible timeline, just because I've had a couple of patients who that's kind of what their timeline was on. So, a patient, let's say, will reach out to me and say, "Hey, I just got a positive test for Bartonella henselae, and I really am interested in doing SOT." So I'll say, "Okay, let's get you in for a consult as soon as possible." And they'll do the consult and the blood draw on the same day, and say I can get them in, right away the next week. So then we send the blood draw off. Oh, and this is bearing in mind that they've again been off of any therapeutics which are specific to the Bartonella. So, for example, that would be any antibiotics or any sort of antimicrobial herbals that, are trying to kill or suppress the same target as the SOT. So say they're off for 14 days, get their blood drawn. We send the blood off. The lab creates the SOT, sends it back. So then that's, like I said, a 4-week process. So then the patient can come back in to the clinic in about a month to schedule their IV infusion. And again, needing to be off of those therapeutics for 14 days again prior to the actual infusion for the SOT therapy. And then on the day of the therapy, uh, you just don't want to do any other therapies. So, there's no therapy that you can do like on the same day that's going to help it to work better. You just want to make sure that we don't want to be interfering with it. So, you can take if you have some vitamins that you like to take, making sure that you've got like a good meal, things like that. But we just would recommend, that you're not doing any other IV infusions on that same day. And even 14 days prior, really, we wouldn't want to be doing anything such as like a high dose vitamin C, just because that can be, very sort of like antiviral and antipathogenic as well. Don't want to be doing anything like the ozone IVs or hydrogen peroxide IV, even the colloidal silver. So anything that's going to be kind of like antimicrobial, antipathogenic, we just don't do for 2 weeks prior. So then on the day of the SOT, you just make sure you're kind of, well hydrated, have a good meal. And the actual procedure itself is pretty simple. So the patient has a choice. They can either take an oral famotidine, which is just Pepcid AC, and that's just to kind of make sure that we don't have any kind of, sort of like histaminic, sort of like a mast cell response or any kind of nausea during the infusion. It's just kind of a safeguard. So they have the option to take that as an oral agent, or I can do it as an IV push once I establish the IV access for the procedure. And if I'm doing it IV, then we just wait about 20 minutes and then we start the actual procedure. And the procedure itself, it involves a small amount of dexamethasone, which is a steroid, and that's administered via a slow push. And the reason that we do that is to stabilize the vasculature. So you want your veins really, really stabilized because we don't want any of the SOT to leak out. We really want it to be going in and then getting into your body and going all through, everywhere that it can go within your bloodstream. So that small amount of steroid that we administer just makes sure that the vasculature is extremely stable. And then the actual SOT itself, like I said, it comes in a very small vial. It's reconstituted with sterile water. And then that itself is administered again over a slow push. And it's just, we go cc by cc with just regular old sterile saline in between each one of those cc pushes. So it's essentially like a saline hydration drip. And I like to just use half a liter of the saline so that we get some nice hydration along with your SOT infusion. And that's it. It does not take very long at all. With the famotidine, that adds on an extra 20 minutes if we're doing it as a push. Otherwise, the whole IV itself is about 20 minutes. So that's what the actual procedure looks like. And then, as far as sort of any kind of reaction to it, just as with any kind of herx reaction, we might see something within a few hours to a couple of days. And then, so sort of the peak of some of those, whether it's an immune or die-off reaction, tends to be within that first week and within the first few days as we see it. And of course, we have so many things that are supportive uh, for working with a herx or die-off reaction.
Yeah, so I mean, the possibility for a herx reaction is definitely there. We have found that, I don't know, what have you noticed, Dr. Jules? I have found that like the patient reports not that the herxes aren't terrible.
Yeah. Yeah, I mean, again, it's so patient specific. I have had patients who've really tolerated the procedure incredibly well and had, I mean, pretty like absolutely no side effects whatsoever. They just started to feel, more energized basically as the pathogen was kind of like the load was coming down and they were starting to feel better within the following weeks. Um, but then, I've had other patients that are very, very sensitive. They're sensitive to the Pepsid, they're sensitive to the saline and everything. Some people are very sensitive even to an IV infusion and how their body's homeostasis is responding to something even going into their vasculature in the first place. So it's again, it's patient specific, and we go slow and delicate and easy where we need to. And another option along those lines is that sometimes a patient may want to split their SOT, and they do have that option. So you can do half of one, SOT, and then a few weeks later do the other half. So you don't actually have to do the entire SOT in one dose. And so if somebody is sort of ultra sensitive, then that's something that I might recommend to them.
Yeah, that's a good point. I'm glad you remembered to bring that up. Because some of our more sensitive folks, even just for peace of mind, like
Yeah.
feeling like they're not going to get this whole thing all in one go. But yeah, but there's never been an allergic reaction, right?
Nope, no allergic reaction. And, some people, they'll hear the word steroid and they're like, I'm running for the hills. So,
Right. Well,
so
and to be fair, we do coach Lyme patients that steroids are immune suppressive and
yes.
are not ultimately helpful. So I think it's fairly widely accepted in the Lyme world that steroids are not ideal.
Sure, of course, and absolutely. So with that, the patient does have the option to not use the steroid. It's recommended, but they have the option to not. And in which case we have a small waiver that just says I decided not to use the steroid. So I do want to offer that as well. But I would also like to reiterate that the amount of steroid that's used is so small that it's not it's not like a steroid regimen or this like heavy hitting you've got to take this much on the first day, this one on the second. It's just a small one-time thing.
Yeah, and it's just designed to make the treatment work better.
Exactly.
It's not that if people opt. We strongly recommend to incorporate it because that has been developed as part of the protocol to make it work better. We did have a patient that was not comfortable with doing the steroid. And it's not that anything bad is going to happen if you don't do the steroid either. It's just we want to make sure that all of those SOT molecules like get where they're meant to be going. And to that point, I just remembered another recommendation is like once you have the SOT infusion, you don't want to be going off to LabCorp and having like 15 labs drawn either. Because that's some expensive blood they were taking out at that point.
Yeah, so any major blood draw, it is recommended to wait at least 8 days, so a week and a day after the SOT, because like don't take it out. This
Don't
is
go take it out. No.
Expensive blood.
Yeah. But see,
yeah,
these are the things too. If you're sort of sounding like, oh, this is confusing about this 2 weeks and this 3 weeks and what's happening here, this is what we plan out for you as part of the SOT consult. So you are absolutely crystal clear. You're not going to do the wrong thing of like, oops, I took this and I didn't realize I was meant to stop that. Like that's what the SOT consult is for, to look at your labs, to determine targets, to get labs ordered. If you don't have labs in the last 6 months, we can get those ordered, to coach you on this is a timeline. This is what you're going to stop here. This is what you can continue. And, and some people may feel a bit worse for that couple of weeks off stuff. But if you're going to make the investment in SOT therapy, it's worth doing it right and doing it to get the best results. So we coach you through all of that. Like, so don't be overwhelmed by all the sort of the rules. We are here to provide the guidelines on how to optimize it,
Yeah.
and get the best results from it.
And yeah, along with optimizing, I like to say that some of the things that we use just in general to optimize some of our complex chronic illness treatment. So this is including things like our biofilm busters and our oral detoxification supplements like glutathione and NAC, any kind of cytokine reducing therapies, that not necessarily pharmacologic, but some of our herbals and other nutraceuticals, binders, and other like routine supplements that maybe are minerals, vitamins, probiotics, all of these kinds of things, postbiotics, even something like a foot bath, or even like an infrared sauna. Infrared sauna, I usually say let's wait a day or two just to make sure that your body is responding well to it. But all those other things that I just mentioned, those don't have to be avoided, when you're doing SOT therapy. So in those weeks leading up to the therapy, and then in those 7 days after, we can do all of these nice supportive things that actually help, the SOT to be optimized as well.
Yeah, absolutely. Absolutely. And then, as we said earlier, we still do our antimicrobial therapy, whether it be antibiotic protocols and herbal protocols, ozone therapy, like outside of those time parameters, we're still very much going after those bugs, so,
Yeah. Yeah, I mean, we're wanting to support the immune system. We're wanting to support all the systems of the body so that this SOT can do its job while we're supporting and optimizing everything all at once. Yeah.
yeah. So let's just talk about what people are noticing. I did do another webinar. It's on our website or it's on YouTube, of, a couple of patient testimonials. That was very cool. But I mean, we are definitely finding that the majority of our patients are having positive outcomes with SOT therapy. And Dr. Jules, you can speak to this a little bit more in a second. And we're also seeing some very cool data, like on lab tests, like where IgMs are going to negative, from positive to negative, and IgG levels are coming way down. And I mean, we're seeing positives turning to negatives on test results.
Yeah.
It's
I mean,
very cool.
I'd say that the actual like outcome in terms of the data, so those numbers that are coming back, I have yet to see anybody whose levels either went up or even stayed the same. So everybody seems to be coming down. And then as far as like the positive clinical outcome, again, it's pretty much 100%. Like there is some kind of positive outcome from it. And this is, like I said, it's matching the data. So, when the studies have been done with the SOT, the viral infected patients, the complete, positive clinical outcome, which is either complete or partial response or, absolute stabilization of the disease, for viral was 91% after 2 infusions for a target. And then again with any of the Lyme disease, so many of our tick-borne, including Borrelia, Bartonella, Babesia, after 1 to 2 infusions, 95% of cases had that positive clinical outcome. And that is matching what I'm seeing.
Mhm. Yeah,
Yeah.
absolutely. Yeah, it's a good one. It's a good one. So before we wrap up, and if anyone has any questions, feel free to pop them in the chat or the Q&A box. Dr. Jules, is there anything else that you want to share about SOT that we didn't cover or that you think would be helpful for people?
Yeah, I mean, I know at the beginning we kind of mentioned that it is also utilized as an oncology therapy. And, the same thing, it is an option. And I have been working with our GCC in terms of some of their oncological testing, which is really neat as, something to utilize for adjunctive therapy. And I've seen, I mean, just within a couple of months, the most incredible reduction in like lab markers and symptoms and recovery. I mean, I'm talking like stage 4 cancer patients, and So these tools are just, it's really cool technology. So the SOT can be used as an oncological therapy as well, is kind of what I was going to mention. Um, but yeah, I know that there is conflicting kind of, stuff out there on the internet if you really dig. Is this lab verified and is this safe? And, you know, as far as safety, very, very, very safe.
Mhm.
We don't have, full on like, US patents, and we haven't done, the incredibly rigorous and ridiculously expensive, kind of that whole NIH FDA route with these SOT therapies. And the reason being, first off, is because it's individualized. So this isn't like one drug that can be, it's not one drug, one agent that we're using with everyone. It's specific to the patient. So, people are like, well, is it FDA approved? And the thing is that antisense therapy, so actual SOT kinds of drugs, there are some that actually are out there that have been used and that they are completely FDA approved, but they're for different targets, not yet for like the tick-borne and stuff. But so I guess I just am trying to say, yes, it's extremely safe. Nobody's had, a wildly no kind of negative reaction to it really, that I've seen or even heard of. I think that, as far as, getting people's expectations around the therapy, I think it's important, again, as we've reiterated, just to bear in mind that let's use SOT in conjunction with other things so that it's like, as optimized as possible. It's, one therapy in our entire milieu of, coming at this from very various different angles.
Yeah. Yep. Yep. I'm having a couple of questions about costs here. So we'll spell that
Okay.
out. We'll sort of outline that now. So the SOT consultation is $200, and that's like the first step. And then cost of lab testing, it's going to depend on like what you've already had, what you need done. Chances are we'll do the Vibrant panel, what's the Tick-borne 1.0 these days?
Yeah, so the Tick-borne 1.0, I think it's $490.
Yeah.
And that's looking at, I want to say I'll get the exact number of species, but it's a large number of species. And then I do know that the Tick-borne 2.0 is $950 currently, but that's got 214 different markers on it, which is just, I mean, that's a lot of data that you're getting back. So it's actually quite a good test.
Yeah.
Yeah.
So the lab testing is a separate thing. If you already have a positive lab result within 6 months, then we work on that. So we just look at what you've already had for that, and we can facilitate if you do need further lab testing. The SOTs themselves are $2,400. This is correct information at the time of this recording. And that includes the blood draw, the lab fee, the infusion, that's sort of the whole package at that point. So that's the main cost. And then retesting, again, if you have multiple targets. So that was the other thing too. From one blood draw, they can prepare 3 different SOTs.
Yes.
So if you have multiple targets that you want to go after, you can order them off the first blood draw. And
So not to interrupt, but yeah, that's a really good point you make, Dr. Nicholas. So the first blood draw, so say, like I had a patient who wanted to do 6 SOTs. She knew that she really wanted to get 6 of them done within a year. And so off of her blood draw, we can actually draw enough blood to make up to 6, possibly even 7 SOTs, should you want to, off of one draw. Most patients will elect to just do a couple at one time, maybe up to 3 or 4, but that's kind of the nice thing. You can have several SOTs made right at the same time off of one blood draw.
Yeah, and once they send them back, because they send them back, I don't even know how to describe it, almost like this like teeny tiny like crystal kind of substance that then we reconstitute. So it preserves well until it's reconstituted. So you don't have to do them all at once.
Yeah, and I feel confident and safe to have it stored here. We can store it for 6 months or however long before you want to use it.
Yeah, and then the storage on if you were to choose to do a half dose, it's 21 days that you have to do the second half if somebody were to choose to do that. So yeah, so that's the information on that. Any other questions before we wrap up for the evening? All right, I think you're good. Well, thank you, Dr. Jules, for spending the time and explaining all of that, all of the good things about SOT. But I feel like there's a lot of people interested and curious about it and just not quite getting all the information in the one point about how it all works and what we're seeing. But we're loving doing SOT. It's great. And it's just, like I said, there's no one thing for Lyme and related infections that's the slam dunk and the be all and end all. There is just not that one thing. And if there ever is, will be great, because then we can retire and move to Maui. But
But yeah, I mean, and I will say, like, I've just seen so many people that, they do a couple of SOTs and it's life changing, you know. So I think, again, in conjunction with what other things that they've been doing, and again, if we get the right target and we got it optimized, it can really make a difference in terms of recovering and getting the immune system, getting that load down and getting that immune system back up so that it can be functioning to get you back up and going too.
Yep. Excellent. Yes. And so we are both taking new patients currently. I'm taking new patients, like general new patients. Dr. Jules does patient care as well as doing the IVs and ozones and SOTs and all the things. So,
and hyperbaric oxygen, I'll mention.
Hyperbaric oxygen, indeed. Yeah. So, all right. Well, thank you so much for joining us. For those of you that were on live, for those of you watching the replay, thank you. And let us know if we can be of service to you. And otherwise, have a beautiful day.
All right. Thank you all so much.
Good night.